Good day, I'm John Palacian, second year nursing student from Pamantasan ng Luzon de Marikina, and I'm going to perform preparing and giving medication through subcutaneous injection. Why it is necessary? Because it is one of the function of the nurse to administer drug to our patient. The first thing I'm going to do is I'm going to remove all my jewelries because I'm going to perform hand hygiene. Perform hand hygiene, so we're going to reduce the risk of transmitting microorganisms, and then I'm going to observe infection control, so we're going to prevent cross-contamination. The next thing I'm going to do is I'm going to assemble all of my equipments, which is the gloves, the medicine or the insulin, the tomato which will serve as the patient, and then the aspirating needle, then the syringe, 1 cc syringe, and then wet cotton balls, and then the MAR. The MAR, medical administration record. The purpose of MAR is so we're going to able to know the right route, right patient, right dosage, right time, and right drug. Then and also we're going to compare if the medicine and the prescribed medicine to the MAR is correct. The next thing I'm going to do is I'm going to perform gloving. Then next is I'm going to get the medicine or the insulin. Then I'm going to get a wet cotton balls. Going to rub the rubber cap of the vial, inner to outer, and then I'm going to let it dry, and then I'm going to get the syringe. I'm going to remove the original needle, then place it in the sterile area, and then I'm going to get the aspirating needle. I'm going to put it in the 1 cc syringe. Once you're done putting the aspirating needle, you're going to look for the MAR, and then you're going to look for how how many cc that the medicine is prescribed by the doctor. In my case, the prescribed amount of medicine is 0.5 cc. So I'm going to inject air, inject 5 cc air, 5 cc, and then I'm going to inject it in the vials. So we are going to build up negative pressure from the vial, and I'm going to start aspirating medicine. 5 cc, 0.5 cc. Okay, 0.5. Then I'm going to put the medicine in the flat surface. And then I'm going to cup the aspirating needle by scoop method. I'm going to cup it, and then I'm going to remove the aspirating needle, and then I'm going to discard the aspirating needle and put it in the sharp container, and then I'm going to get the original needle, then I'm going to put it back. Once I put it back, and then I'm going to put it in the sterile area. Then the next thing I'm going to do is I'm going to perform giving giving medication by subcutaneous injection. First is you're going to the tomato. This will act as the patient or the arm of the patient. There are many part of the area of the body you can inject the subcutaneous, and then the lateral part of the arms or in the abdomen, both side, and then lateral part of the thigh. Then in my case, I'm going to inject it in the lateral part of the arm. Then you're going to get a wet cotton balls. You're going to rub it inner to outer in the area that you're going to inject the medicine. Then you're going to discard it, and then you're going to uncap the syringe, and then you're going to pinch it. For example, you're going to pinch that, and then like that, and then in 45 degrees in 45 degrees you're going to inject 45 degrees, or if your patient is fat or a big big guy, it is okay to inject it 90 degrees. But in my case, it is just a normal body shape, so I'm going to inject it 45 degrees. Then inject it in the part that you rub with the alcohol. Then slowly inject it, and then hold the head of the syringe, and then going to slowly inject 0.5 cc of medicine. Then after that, you're going to get a cotton balls. After you alis, and then you're going to put a cotton balls in the part that you injected. Then going to cap the syringe with the scoop method. And then going to tape to put a band-aid in the part of the injected part. Then the next thing I'm going to do is I'm going to gather all of the necessary data, or all the data, and then I'm going to discard all of the used items, and then going to take off the gloves, and then discard, then gather all of the necessary data, and then I'm going to perform again hand hygiene because I touched the syringe, the body of the patient, and then that's all. Thank you.